This is CBS 5 Eyewitness News.
Bay Area doctors are using new technology to help diabetic patients preserve their eyesight. Dr. Kim Mulvihill has all the details. Hi, Kim.
Hi, Dana. You know, diabetes is the main cause of blindness in adults. But if you're uninsured or low income, getting and paying for an eye exam may be impossible. Well, now, thanks to a professor at Cal, we see a solution.
Okay, just look at that green light. You see it?
Sean Kirkland of Oakland has diabetes.
Great.
And she's uninsured.
Great picture.
Because of that, Sean qualifies for an unusual eye exam at the Lifelong Medical Health Center in Berkeley.
It didn't take a lot of time at all. It was very quick and very professional.
The exam involves a digital camera that takes high-resolution pictures of the patient's retina. Then, using license-free web-based software,
this is a healthy eye.
The high-def pictures are sent electronically to optometrists, many at UC Berkeley, who scan the retina for the #1 cause of blindness in adults.
Yeah, you can see the bleeding here. The white spots are where you have leakage.
The condition, diabetic retinopathy.
When the blood sugar rises from diabetes, uncontrolled diabetes, then the small blood vessels inside the eye begin to break down, and you have a lot of bleeding, scarring, and tissue death. And that's generally what causes the blindness.
Dr. Jorge Cuadros of UC Berkeley and the California Optometric Association is the driving force behind the project, called IPAX. He says annual exams are crucial for anyone with diabetes. However, a growing number of Californians are uninsured or under extreme economic pressure.
You could imagine sometimes the eye exam would be what they would pay for groceries for a whole week.
With diabetic retinopathy, the symptoms are few, and patients can suddenly go blind overnight. If caught early,
90% of the cases of blindness from diabetes can be prevented.
And IPAX fills a need.
It's really awesome, and we can offer it to people who don't have insurance.
As for Sean, good news, no retinopathy.
The results were great. I was nervous in the beginning, but the results were fine, and the machine is a lifesaver.
Now, the IPAX project began in California's Central Valley, and today IPAX has expanded to 110 clinics throughout California, as well as Arizona, New Mexico, New York, and Connecticut. To date, doctors have screened more than 50,000 patients, and nearly 1 in 5 needed help.
Wow.
Imagine.
I cannot.
Again, you can prevent 90% of the problems if you get it screened and treated.
That's great to know about. Thank you, Kim.
Sure.